Hello, my name is David Goodkind, a board-certified plastic surgeon since 1984 and the owner and director of FUZION Medical Aesthetic Boutique. This is one of the many videos I have created where I briefly describe the salient points of the cosmetic surgeries I perform. Consider it a quick introduction to the surgical procedure, a start to your education process. It will stimulate thought and questions. It should, by no means, be interpreted as a substitute for a complete in-office consultation. The video is a simple presentation without diagrams, pictures, or other visual aids. I would encourage anyone interested after watching to navigate through my website, FUZIONCT.com, look at the before and after examples of surgical and non-surgical procedures and the text, and then make an appointment for a complimentary, in-depth, personal, and private consultation. At that point, I and my team of aesthetic experts will be able to speak more specifically about your desires, your anatomy, and your expectations. We will then formulate a detailed plan personalized for you. I look forward to seeing you at FUZION in the very near future. Thank you very much. Okay, so let's now talk about breast augmentation. Breast augmentation is a wonderful operation. The ideal candidate for a breast augmentation is a woman with small to moderate sized breasts that are not too droopy, such that if we place an implant into her breast, and I'll discuss later, into her breast underneath the muscle, it will fill out her breast envelope and give her a very pleasing, youthful, larger, and uplifted look. In theory, a breast augmentation is quite simple. In practice, the procedure is demanding if you're looking to get great results consistently. Who wants a breast augment? People with small breasts who haven't been gifted with large breasts, people that have damaged their breasts, so to speak, due to pregnancy or weight loss. These people get good results. I always try to put the implant in underneath the breast and muscle. There's two reasons why you put it underneath the muscle. One, if you really need the operation, you need more of a soft tissue slope in the superior aspect of your breast to get a nice result. And two, it hugely decreases the incidence of capsular contracture. If you've read about capsular contracture, it's when scar tissue forms around the breast and contracts down around the breast so that the breast feels really firm and rides up too high. In most patients, I'd say putting them underneath the muscle, as long as I'm not instructed to stuff in the biggest implant I could possibly get in, pretty much eliminates the incidence of capsular contracture. Now let's talk a little bit about the implants themselves. There are multiple implants. Basically, they're either silicone or saline. It's fair to say that whether you use silicone implants or saline implants, your look is going to be the same. I personally feel that using silicone implants, the feel is better. They feel much more natural in that the silicone is much squishier, it's gushy. Those are two great medical terms, and putting them in makes your breast feel more natural to someone touching your breast, or if you dance with somebody or you hug with somebody, it won't feel as firm and as unnatural with saline. We spoke about putting them underneath the muscle. I put them underneath the muscle at operation, and as soon as we wake you up, that muscle kind of wants to go back to where it came from, and that's the reason for the discomfort after a breast augmentation. It's not terrible, it is a little uncomfortable, it quickly goes away after a few days, and I always tell my clients that once they see how nice and pretty their breasts look, they'll put up with a little bit of discomfort. There's minimal risk to the surgery. It's easily tolerated. It's an outpatient procedure. And again, for someone who's a good candidate, and that's for something for us to discuss at consultation, it's a wonderful procedure that leads to an uplifted, much more shapely, much bigger breast with nice superior fullness. Something I think that everybody would like. Thank you very much.